blood supply and lymphatic drainage of the face. Welcome back to the anatomy of the face. In the previous video about the face, we learned about the nerves supplying our face, both sensory and motor. Now in this video, let's talk about the blood supply of the face, beginning with the arterial supply. Get ready to hit the road on a twisty-turny journey as we explore the complex network of the two principal arteries of the face, the facial artery and the transverse facial artery. Join the ride as we navigate the winding paths of these vital blood vessels. The facial artery, also known as the principal artery of the face, arises from the external carotid artery in the neck at the level of the greater cornu of the hyoid bone. After winding around the lower border of the mandible at the antero-inferior angle of the masseter, it enters the face by piercing the investing layer of deep cervical fascia. As the facial artery ascends up the side of the nose to the medial angle of the eye, it gets some company from the dorsal nasal branch of the ophthalmic artery, and together they party it up by anastomosing with each other. The anastomosis occurs at 3 points. First, across the midline with the branches of the other side. Second, with the branches of the ophthalmic artery. And third, with a branch of the internal carotid artery at the medial angle of the eye. These arteries are like the popular kids at a high school party, making new friends everywhere. Now let's talk about the branches of the facial artery. This artery provides designated branches for the face like the inferior labial artery, which supplies the lower lip, the superior labial artery for the upper lip, and the lateral nasal artery, which supplies the dorsum and alae of the nose. Severing the anastomosis of the superior and inferior labial arteries on both sides of the lips can cause a massive eruption of blood from the cut ends. Apart from these, it also provides numerous unidentified muscular branches that emerge from its posterior part. It's like the facial artery is saying, you get a branch and you get a branch. Everybody gets a branch. The facial artery exhibits remarkable flexibility and resilience due to its tortuous path, which allows it to adapt to the movement of the mandible, lips, and cheeks without becoming overly stretched. Think of it as a skilled yoga practitioner, effortlessly contorting and twisting in various directions. So go ahead and take a moment to appreciate this incredible artery, because without it, your face would be quite pale and lifeless. Now let us examine the clinical relevance of this artery. The facial artery can bleed profusely when wounded, but can also recover rapidly. There are two areas where the pulsations of the facial artery can be felt. One is located near the antero-inferior angle of the masseter at the base of the jaw. The other is approximately 1.25 cm laterally from the angle of the mouth. Pop quiz. Now let's move on to the next superficial artery of the face, called the transverse facial artery. It's like the little brother of the facial artery, emerging from the superficial temporal artery within the parotid gland. The buccal branch of the facial nerve follows it as it advances along the masseter between the zygomatic arch and the parotid duct. Talk about a sibling duo. Pop quiz. Now let us discuss the venous drainage of the face. The veins in the face are like a web of pipes carrying all the blood from your face back to the heart. Let's dive in, shall we? First up, we have the facial vein. This one is a big deal, the biggest vein in the face. It is formed by the joining of the supratrochlear and supraorbital veins at the median angle of the eye. From there, it travels downhill, passing behind the facial artery and ending up at the antero-inferior angle of the masseter, joins the anterior division of the retromandibular vein to form the common facial vein, and then drains into the internal jugular vein. But wait, there's more. The facial vein has some deep connections which can be dangerous if not taken seriously. There are two ways of communication with the cavernous sinus. One being the superior ophthalmic vein that travels backwards within the orbit, and the other being the deep facial vein that connects to the pterygoid venous plexus. The pterygoid venous plexus surrounds the lateral pterygoid muscle and connects to the cavernous sinus via an emissary vein. But here's the interesting part. There are no valves in the lumens of the facial vein or its connections. This means that septic emboli can spread from an infected area of the lower part of the nose, upper lip, and adjacent part of the cheek in a retrograde direction into the cavernous sinus, causing meningitis and cavernous sinus thrombosis. That's why this part of the face is known as the dangerous area of the face. Now let's move on to another important vein of the face, the retromandibular vein. It is formed by the superficial temporal vein and the maxillary vein within the parotid gland. After emerging from the gland, it separates into anterior and posterior divisions. The posterior division then joins the posterior auricular vein, while the anterior division connects the facial vein to form the common facial vein. Pop quiz. Let's now learn about the lymphatic drainage of the face. Lymph from the face is drained from three regions. First up, we have the upper territory, which includes the majority of the forehead, the lateral half of the eyelids, including the conjunctiva, the parotid area, and the adjacent portion of the cheek. The lymph from these areas drain into the preauricular lymph nodes, which are also called superficial parotid lymph nodes. The middle territory includes the greater part of the lower jaw, the medial halves of the eyelids, the external nose, the upper lip, the lateral part of the lower lip, and the medial part of the cheek. The lymph from these areas drains into the lymph nodes, submandibular lymph nodes. The lymph from the lower territory, which includes the chin and the middle of the lower lip, drains into the submental lymph nodes. With that, we come to the end of this session. We hope you had fun learning with us.